Good afternoon and welcome to the City of Toronto's COVID-19 media briefing for Wednesday, September 2nd, 2020. Joining us today, Toronto Mayor John Tory and Toronto's Medical Officer of Health, Dr. Eileen de Villa. Mayor Tory.
Well, good afternoon and thank you, Brad. And while it is not directly related to COVID-19, I want to start by acknowledging the brazen shooting that we saw at Eglinton and Oakwood overnight, and to state what I know is something that is very strongly felt by all the people of the City of Toronto, but including me as mayor, and that is that this kind of gun violence is absolutely unacceptable. Firing a gun into a crowded bakery is incredibly dangerous. It is reckless. It demonstrates an absolute disregard for human life. And so in that sense, we're just going to have to continue and redouble our efforts to fight this kind of violence. I want to begin in my remarks on this today by thanking the first responders, the Toronto Police Service, the Toronto Paramedic Services, because they responded quickly to this shooting. I have no doubt that their emergency response helped to save lives and save more serious trauma and prevented an even greater tragedy. And make no mistake, this is a tragedy. Every person shot in our city is a tragedy. The hurt and the pain and the anguish caused by gun violence to people in our city and to communities in our city is real, and it has been inflicted on far, far too many people. At the city, we continue to invest in more programs to address the root causes of violence and to help kids and families. Millions more this year alone, including new programs and including the expansion of existing programs. And we will invest more as we must. We have advocated for real change to gun laws and to bail laws, just to pick two examples. There are still far too many illegal guns out there, and repeat gun offenders are still allowed to be out on bail when, based on their own records, they should be kept in custody. We're working to modernize our police service and to bring about real change to address systemic racism, to rebuild trust with communities, and to make sure that our service is even more focused on violent crime and that some responsibilities better handled by others are reallocated elsewhere. But at the same time, we have supported, as a city, our police so that they could hire more officers with a particular focus, for example, this year on hiring more neighborhood police officers. Our acting chief has outlined to the police board, of which I am a member, a new plan that he's implementing now, which includes reallocating specific resources to help get at guns and gangs and gun violence. A good portion of this gun activity is in fact gang-related and is also related in turn to drugs, to gun trafficking, and to human trafficking. I have confidence in Chief Raymer and the adjustments he is making, and he and his men and women need our support in coming to grips with this, even as we move forward with policing reforms. But we cannot address gun violence alone. And I would again appeal to the Government of Canada to help us and to help cities across Canada by delivering the anti-gun violence initiatives promised earlier this year before the COVID-19 pandemic struck. I would urge anyone with information about this shooting to please contact police or Crime Stoppers to help them solve this crime and bring the perpetrators to justice. Now, this shooting happened in Little Jamaica. It's one of many neighborhoods I know where businesses have been hard hit by COVID-19. And before that, in the case of Eglinton West, which is where Little Jamaica, as it's called, is located, the impact as well of the Metrolink's Eglinton Crosstown LRT construction had a profound effect on small business. We've worked throughout this pandemic to help small businesses, like the ones in Little Jamaica, to survive. I know the lockdowns and the restrictions have been tough for small businesses, and I share the fear that we've heard from the Canadian Federation of Independent Business and others that COVID-19 will lead to a large number of business closures. Small businesses are the backbones of so many neighborhoods. If you think about what leads to the health and the vitality, it's the people who live there, of course, but it's also the businesses, in addition to some of the community institutions that are there, that bring those neighborhoods alive and keep them a lively place where people are together, where commerce is done, where jobs are located, and so on. We have worked as a city government to help where we can by providing supports through things like our digital Main Street program. through property tax deferrals for 60 days. We tried to help small businesses to manage their cash better during the early stages of the pandemic. And through programs like Cafe TO and Curb TO, we've helped to open up spaces on our streets so that restaurants, for example, could operate for people to line up or pick up curbside delivery, or to enjoy some refreshments outside when people are still concerned about being inside many of those premises. And in fact, those cafes and patios were put in place at a time when the inside of restaurants weren't even allowed to be opened. I've also held meetings in the past week. I've held them on a regular basis during the pandemic and do throughout all periods of time with big employers and with large downtown landlords to discuss how we can bring people back to work in the downtown core with the confidence that they need to come back safely and comfortably and in good health. We know that that will take time. And that passage of time is not on the side of small businesses. In fact, it will continue to cause hurt to many of those small businesses who rely on vibrant and bustling downtown workplaces, just as the neighborhoods support the small businesses on the main streets across the city. I'm committed to protecting small businesses, and that is why today I'm indicating that I believe the provincial government, I'm calling on them to extend the moratorium on commercial evictions that expired 2 days ago. And why, as well, that I've been advocating directly to the Deputy Prime Minister and Finance Minister of Canada, Chrystia Freeland, and to the Minister of Finance for Ontario about the need for us to look at things we can do, additional things we can do to help protect small businesses. I can tell you that the Deputy Prime Minister and Federal Minister of Finance, she gets it, as does the provincial minister. But I can tell you that for her part, she is looking for effective ways to help, including through existing initiatives. And I want to say one more thing to her and to her government and to the Government of Ontario as well. Carefully done and targeted additional investments now in small business will save jobs, will preserve businesses, and will ultimately speed up and strengthen our recovery as cities and as a country. That, in turn, will allow us to fix our public finances faster. The alternative, thousands of boarded-up businesses across the country on main streets and downtowns, and many more people unemployed in the longer term, is bad for Canada, it is bad for people, for the people of Canada, and it will make financial recovery for governments much more difficult and take it a much longer period of time. So I hope that they will act and act quickly to put in place measures that are going to be needed. I believe this will be one of the best investments they could make, of many they've had to make, admittedly, to make sure that we had an economy to recover, a foundation that was still there to bring us back. We continue to do everything we can as a city government to help people go back to work and go back to school with confidence. And to that effect, I endorse the Premier indicating to people that they should make use of public transit, that it is safe, they can be confident in it. It is why I use public transit regularly and did in fact make a point of highlighting the fact that I was on transit again this past Monday, because I want people to know that I have confidence in it, they can have confidence in it, and that many, many precautions have been taken so that transit can be safe for them to use. It's also why our city staff continue to work with the school boards to make sure that kids can go back to school safely and in good health and stay in good health in the days ahead. Those discussions with the school boards in the city are ongoing, and as the school boards finalize their enrollment, and we hope to have an update early next week on all of that. Today is our last media update before Labor Day. While this has been a summer like no other, thanks to COVID-19, some things remain the same. Labor Day is still the unofficial end of summer, even if the calendar has a few more days of summer left for us yet. Almost 6 months ago, when this pandemic began, and we were facing grim projections on what the impact of COVID-19 would be, along with seeing this virus raging in other cities like New York and in countries like Italy, Labor Day seemed a long way off. Many of the things the city has accomplished this summer didn't seem possible. In fact, we hadn't even thought of some of the alterations to programs and the new measures we took to protect people and support people and keep them healthy. But thanks to the people of Toronto, the vast majority of whom have followed the consistent and professional advice of our medical officer of health throughout, along with our city staff and countless partners in the nonprofit sector and in the private sector, we have helped to really slow down to a very small number, relatively speaking, the spread of the virus. We've flattened the curve, and we've moved to restart this city, Canada's economic engine. we got this far, and we still have a long way to go, but we got this far because our city is strong, and because the people are strong, and because the people worked together. The governments worked together. Nonprofits and governments work together, and people work together. And we're going to come back strong. And while we're going to continue to be cautious as we move past Labor Day, as we must be for all the reasons that have been so well outlined by our Medical Officer of Health, it is this progress through the spring and summer that should give us confidence that we can face what lies ahead, even if it does include, as we're told it likely will, some kind of a resurgence. As we head towards Labor Day, I want to thank all of our frontline workers again, because I don't think we can thank them often enough for their service in making this progress possible and for making sure we were there for our residents and businesses throughout the last 6 months and into the future. And I want to thank the people again for their compliance and their cooperation and their working together and for their supporting each other. And just to say that over this weekend, when there will be lots of opportunity to have a good time and perhaps let down our guard, please stay the course. It is the course that we're on that has had us make progress. It is the course that we're on, if we stay on it, that will help us to continue to make progress. And I'm now pleased to turn the podium over to Dr. de Villa.
Thank you, Mayor Tory, and good afternoon, everyone. Before I begin today's update, I'm pleased to share that our provincial colleagues at Ontario Health are supporting another pop-up testing site in our city this week. Testing will be available at Shoreham Park, located at 2 Shoreham Court, this Friday from 1 in the afternoon until 6 in the evening. Thank you again to the community leadership in the Black Creek area and to Ontario Health for this important initiative. In Toronto, we continue to see new COVID-19 activity. Our local numbers are starting to increase again, with 48 new COVID-19 infections since yesterday. This week alone in Toronto, there have been 123 infections. This is concerning for all of us. As I shared in my last update, it isn't a matter of if we'll see more COVID-19 activity. In our city, it's a matter of when. I'm concerned because this is now what we're starting to see. We need to be careful and vigilant in our actions to keep each other safe as we return to school, our workplaces, and spend more time inside as cooler weather arrives. As we approach back to school, it often feels like a natural fresh start for many of us. So for today's update, I'll share my advice for a safer return to school and safer socializing. Back to school is a time of year typically filled with excitement. This year, many are feeling uneasy about this. Some may be worried about their child's ability to follow directions for physical distancing or wearing a mask. Others may be concerned about bringing the virus home to grandparents or other vulnerable relatives. I've been asked if I'm sending my children back to school this fall, and the answer is yes. However, my youngest is in high school, so the decision is a little simpler for my family. I know that everyone needs to make decisions that are best for their children and their unique family circumstances. For some who live with elderly family members or have health conditions, these decisions aren't necessarily straightforward. If you are sending your kids back to school, there are ways to help them prepare. You can help them practice wearing a mask at home so that they can get comfortable with this before they go into the classroom. Teach them how to put their mask on properly, how to wear it, and how to take it off. Make sure your child's mask fits comfortably and covers their nose, mouth, and chin. And send at least 2 clean masks with your child to school each day and explain to them when they should change their mask. Also, send 2 bags to store clean and dirty masks separately, and remind your child not to share or trade their masks with their friends. You can also help prepare your kids by explaining how school will be different this year. Teach them how to wash their hands, practice physical distancing, and wear their mask. Remind them that you can sense a smile in someone's eyes, even under a mask. So they should greet their friends with a big smile, a wave, from a safe distance, and not share their food or other personal items. And create a routine to screen your child for symptoms of COVID-19 before each school day. It's also important to watch for signs of stress or anxiety in your child. They may have a lot on their mind, and they may or may not talk about it. Remind them that it's important to think about COVID-19 and their actions when they're at school, but let them know that it won't be this way forever. Let them know it might be a little bit like looking both ways before crossing the street or wearing your seatbelt, because it's actually about their safety and good habits to protect them. Ask them about their day so that they can share their feelings. For example, they may worry that a friend got too close or that someone wasn't wearing their mask the right way. More than ever, it's especially important to keep your children at home if they're sick. It's also very important for everyone to get the flu vaccine this fall. While many of us are preparing to send our children back to school, many of us are also looking forward to squeezing in that last little bit of summer fun this coming weekend. And while you're doing this, I would ask that you please be careful while you're socializing. The choices we make this Labor Day weekend have the potential to affect all of us in the weeks and months ahead. Our city has done well this summer keeping virus spread down. This is because you followed public health measures. It's also because we've been mostly socializing outdoors. But I don't want anyone to have a false sense of security. I know that many believe that since they didn't get sick in these past months, that they're in the clear and that they can go back to life as it was before COVID. But this simply isn't true. It's also dangerous to think this way. This virus is very infectious and easily passes between people, especially when you're indoors. And you may not know if you're infected with COVID-19 or if the person next to you is infectious. It's on all of us to proceed with an abundance of caution to reduce virus spread as we head into the fall. We must make sure that we don't unknowingly pass the virus on to someone else. The person next to you might work in hospital or long-term care or have a weaker immune system. This is exactly why each and every one of us must continue to do our part to help protect each other. I know that none of us envisioned the year we've had. And I know we are all tired of physical distancing and sticking with one social bubble. I've heard that many people are now bending the rules or bursting their social bubble to spend time with more people. The fact is, we're seeing COVID-19 infections in our city resulting from people choosing not to follow public health advice. Just this week, we identified new infections amongst people socializing indoors without masks and at close distance. These are exactly the kind of situations that are contributing to virus spread in other parts of the country. You may believe that because you're younger and otherwise healthy, you may not suffer severe illness from this virus. But this is simply not true. We have all heard stories about young, otherwise healthy people getting sick with COVID-19 and suffering from profound fatigue for an extended time, amongst other longer-term effects. The truth is that the only safe way forward is to keep following our public health measures. Wash your hands, watch your distance, and wear your mask. Everyone doing their part is what has kept Toronto from experiencing outbreaks like we're seeing in other cities. And I cannot emphasize enough just how critical our behavior today is in determining what happens next. So I ask everyone to take a moment to consider how they may be bending the rules and to start today by resetting our habits. This will be critical to how we manage as a community in the next phase of this pandemic. This is the only way we can protect each other, our economy, and make sure that we don't go back to even more restrictive measures as we did in the spring. So please, as you are outside and enjoying these last days of summer, I ask that you all take my advice seriously. Stick to one bubble of up to 10 people. Avoid crowds, closed spaces, and close contact with people outside your bubble because the risk of infection is high. Wash your hands, watch your distance, and wear your mask. And as I have asked you from the beginning of this pandemic, please continue to take care of each other. I'll now hand it over to Brad, and we're happy to take any questions.
Thank you, Doctor. Number of staff on the line for any questions reporters have, including staff from shelters, bylaw enforcement, parks and recreation, transportation, and long-term care. First question is to Francine Copen from the Toronto Star. Go ahead, Francine.
Oh, hi. My question is for Mayor Tory. Mayor Tory, how likely are you more or less likely to declare a lockdown again, given that what we've been through already, and given that people may be suffering from, lockdown fatigue, and sort of given the economic dislocation that it caused?
Well, we were careful the first time. I mean, I can tell you that my own immediate reaction on the morning that Dr. de Villa made a presentation to us that projected thousands of deaths in Toronto if we didn't act was immediate. Because the status quo was producing a result that would have been wholly unacceptable to the people. It certainly was to me, and even the results we did achieve with the lockdown were tragic in the context of the number of lives lost in the city. But as I've said throughout, I will abide first and foremost by the advice of the Medical Officer of Health and her experts and the other experts we rely on. We will work closely with the province and the federal government to make what would be a very difficult determination. But I can tell you that, that in the end, preservation of life is the most important thing we're all charged with the responsibility to do in many different contexts, including this one. And so we have to be mindful of the economy and of the impact that a bad economy has and business failing and so on has on people's health. But having said that, we have to place preservation of lives first, and I will abide by the expert advice that I've had, but also consult with the other governments on how much we can sustain in the context of people and businesses being dislocated.
Follow-up, Francine?
No, that's it. Thank you.
Okay, thank you. We go next to Matt Bingley from Global News. Hi, Matt. Go ahead, please.
Hi, good afternoon. Dr. de Villa, I'm just wondering, in recent days, we've seen the number of cases of infections involving malls increasing, and I'm wondering if there's anything particular about those that you're seeing as a concerning pattern, or anything that you think that would be would warrant going back and looking at the guidelines for businesses in this setting to try and knock those back down.
So thanks, Matt. And I think you asked some interesting questions, but let's look at our circumstances and let's look at what we've been talking about for the last several months now. So we know how this virus transmits, and we know that indoor spaces are at higher risk. And yes, there have been some cases in the last few days, some associated with businesses that are located within malls. However, they are unique to certain businesses. These are indoor spaces. And as I mentioned in my remarks, some of the cases that we know of that have occurred in the last few weeks and in the last few days in particular have been associated with some degree of socializing in closed spaces, in indoor spaces, and with close contact without masks. So I think the important thing here is that we now all know a little bit more about how this virus transmits, and we know that we're interacting with each other, which by definition increases the risk. The important part is that we know what it takes to reduce that risk, right? Washing your hands, watching your distance, wearing your mask, staying home when you're sick. And if we all continue to practice that to the greatest extent possible, recognizing that there is no perfect, but we do need people to practice these public health measures as much as is possible, that's what actually brings our risk down, and that will allow us to continue to have these activities, to continue to allow these businesses to operate, so we don't get the kind of dislocation that the mayor just talked about.
I guess I'm just wondering, these protocols have been in place for quite some time now. Is it in the investigations you're finding that people aren't following the guidelines specifically, and have you had any contact with those specific instances where you're able to actually shift their tone or change their behavior? You know, you were talking about masks. I know some businesses are using face shields instead. Should they all be going to face masks instead, for example?
So I think we are using every opportunity that presents itself. And certainly each time we investigate a case, there is an opportunity to engage in education. One, our first and foremost is to make sure that we're investigating the case and ensuring that the contacts are followed up. But with each of those contacts, there's an opportunity, because hopefully they don't all turn into cases. But there is an opportunity to educate and talk about what measures actually make a difference. So we are absolutely looking at each case as a chance, taking that chance to make sure that they're aware of what the circumstances are, what we feel might have contributed to the acquisition of that infection, where the risks existed in terms of ongoing transmission, and how best you address that. And certainly we've had with individual cases some exposures that thankfully did not lead to infection, but lots of opportunities to speak to those contacts about how important it is and how lucky they were to not get sick, and we ask them to help carry on that message. And yes, that applies both to individuals and to businesses. So, you know, again, we can't emphasize enough how well the public health measures work, how important they are to continuing to control virus spread, and how they will become even more important as we have more interaction with each other, and certainly as we move indoors as the weather naturally gets colder.
Okay, thank you. We go next to Lance Hornby from the Toronto Sun. Go ahead, Lance. Hi, Lance, you there? Okay, maybe we'll come back to Lance. Let's go next to Jason Chapman from AM 640. Go ahead, Jason.
Oh, hi, Brad. I could hear Lance. Can you hear me?
I can hear you. We can't hear Lance on this end. But go ahead with your question, Jason. We'll come back to Lance.
No worries. Thanks. First question is for the mayor. Hi, John. It's Jay here. I just wanted to get your reaction, John, very quickly to news out of Oakland, where sheriff's deputy has filed court documents suggesting racism wasn't a factor in his interaction with Masai Ujiri. I know it's sort of out of left field, John, but I'd love to know your thoughts on that court filing.
Well, I rely on people like Leo Routens, who have said that they, walked courtside on the same moment of the same night, a night of great jubilation for everybody associated with the Toronto Raptors, including their fans, and wasn't stopped for a second. And yet a man who is the president of the Raptors and was trying to do the same thing with credentials around his neck was given what could only be described as an incredibly brutal shove, a couple of them, in fact. So, people can draw their own conclusions as to what was behind that, especially given some of the history that we've seen. So, look, I guess if they have so much evidence that suggests that all these things never happened the way that the video says they did, then they should produce that evidence, and they should produce it now as opposed to waiting around for some trial that may or may not happen in the near future, because, you know, in the meantime, I think the video we've all seen speaks for itself, and I would say, as Torontonians know well, the character of Masai Ujiri speaks for itself as well. And so I think right now the ball is in their court to stop with all the you know, all of this, these statements that are impugning his character, and just get on with whatever it is they have to say, if they have anything to say, which I don't think they do.
Follow-up, Jay?
Thanks. Yeah, just for Dr. de Villa, there's been a growing number of people who are calling it, who are frustrated with the daily COVID number counts. I'm wondering if it's helpful or hurtful, you think. We refer to them every day in the media. We say 130 new COVID cases today, but we don't give them a lot of context. We don't talk about how many serious illnesses anymore or how many deaths. We've never counted viruses like this before. If it's helpful, why is it helpful in your opinion, or is it hurtful in some ways?
So I think that's an excellent question, and I think what we've been trying to do throughout the course of this pandemic is to ensure that we're providing data that's of relevance and interest to the public so that they can inform themselves. So when it comes to what I say in remarks, we try to keep it fairly well encapsulated. You know, we as you can well imagine, are monitoring a number of indicators and have many data points that we could go through. But then this would be a rather long press briefing, and it's often difficult to follow numbers in this format. However, for those who are interested in seeing the details and seeing the details around the seriousness of illness as captured through hospitalizations and ICU admissions and the like, those data are actually available on our website. So I would encourage people to make good use of our website to understand the course of the pandemic, to inform themselves, and to follow along with those various indicators that we are monitoring ourselves as the local public health department to get a sense as to what we're looking for as we monitor the pandemic and its impact on our city, as those are the kinds of data points that help us determine what course of action should be followed to protect the city's health.
Okay, thank you. We'll go back to Lance Hornby. Sorry, Lance, I think there was an issue on our end. Go ahead, please.
Okay, thank you. This is for both the mayor and Dr. de Villa. The NHL's Toronto bubble is ending this week. Based on the concerns expressed before 8 teams spent a month in our city, how do you think it's worked?
I must say I didn't hear. It was sort of muffled. Did you hear it?
I did.
You go ahead and answer it, then I'll figure out from your answer what the question was.
Okay, so it was a question around how we felt the NHL bubble has worked this far over this past several weeks. You know, to my knowledge, things have worked out very well. The protocols were very carefully vetted. We certainly had a hand in that. I know our provincial partners did as well. And I believe our federal partners were actively engaged in the whole process. There were many players that had to come together, not just the hockey players, but in fact government, all 3 levels of government worked together and health officials worked together to try to make sure that we were creating the circumstances that allowed for the activity to occur safely. And from my perspective, the primary objective, as it always is to ensure that it's safe for the people of Toronto. So I'm pleased to say that, you know, the safety of the people of Toronto has been well preserved. I think we've all enjoyed having hockey back, albeit at a different time of year than we're used to watching it. But that would be my summation. And I'll turn it over to the mayor, whether he has any particular comments. And just to be clear, I don't cheer for any one particular team. I'm not, I admit, I do watch hockey. I'm sorry to admit that.
She was doing so well in the management of this
know.
pandemic up until now, but this
I
is
know.
a serious flaw that we're going to have to
I'm
address
sorry,
off
sir.
stage here
I'm
today.
sorry.
But Lance, may I just say this? I think this has been a successful model that the NHL and its players constructed with the help of Maple Leaf Sports and Entertainment. I think it has worked out extremely well from the standpoint of the principal objective we all had, including the medical officer of health, myself, all those others involved at the province, which was to keep people healthy, including the players and coaches and others associated with the team, but of course also to protect the public. And I think people would be hard-pressed to know that this was going on in Toronto right now in terms of the fact that the people have cooperated as well by not hanging around outside these hotels and outside the Scotiabank Arena. So I think it's been a great success. We've had some economic benefit from it, and everything helps at this point in time. So I think the only thing that's been wrong with this whole thing is that the Leafs, because I do cheer for a team, and it is the Toronto Maple Leafs, and they'll be back to fight another day, but they were eliminated early, so I think it reduced interest. But I think the model has worked, and let's see it through to completion, but I think it's worked, and I think that's because everybody took great care, including our public health officials, to make sure it was a model that was very thorough and very complete, and people have been kept healthy, everybody.
Thank you. A quick follow for the mayor. There is just talk at this point that next season may not see fans again, and perhaps another bubble situation, perhaps involving Toronto. Based on what you said, any issues going forward that you'd offer up Toronto and the Maple Leafs as well that they would make our city available?
Well, these are not my decisions alone. One of the reasons we've succeeded, I think, in this bubble and succeeded doing relatively well in battling this virus to the stage where we're at, with lots of work left to be done, is because we've worked together. And so I would certainly be prepared to lead discussions with the province, with the Medical Officer of Health, with all those involved, the NHL, the Maple Leaf Sports and Entertainment, the Players Association, to offer Toronto again as a place in which we could keep hockey going here. I happen to believe this is the world capital of hockey. I will look forward to the next season because our team will be back in it again, and by then I will have ensured one way or another that Dr. de Villa is cheering for the only team that the Chief Medical Officer of Health for the City of Toronto could cheer for, which is the Toronto Maple Leafs. There is no other choice.
Okay, thank you. Final question is to Jenny Ewan from the Toronto Sun. Jenny?
Oh, hi there, Mayor Tory. How are you?
Good, thanks, Jenny.
Good. I just had one question. So I know a few weeks ago you toured the Yonge and Eglinton area, and you spoke with residents and businesses and the homeless. We're hearing that the Home Wave restaurant had another break-in overnight, and some of the other independent businesses are still worried about the increase of crime in that area since the homeless shelters came in. What kind of solutions do you have in mind?
Well, first of all, my heart does go out to the family that owns the Homeway. It's a place that's been around for a long, long time. And in fact, I was speaking to one of the members of that family on the weekend because I've been doing a regular round of calls in addition to the visit that I made, and I'll do the visit again. But I've been making a regular round of calls to businesses, to local residents, to people who work in that area. I think the situation has improved significantly, notwithstanding the unfortunate events that happened at the Homeway in the last 24 hours. And it has improved because we've had significantly increased police patrols, community safety patrols. Measures have been taken by our own city staff to make sure that we work more closely with the residents of the shelter to try to help them to be good neighbors, and there's a whole host of things we've done. In fact, the number of things we've done in the last 2 or 3 weeks with the cooperation of the local councillor, Mr. Matlow, have been very long in number, very large in number. So we will stay the course on this in the context of doing whatever we have to do to achieve the 2 goals that I've said from the beginning we have, which is to make sure we look after our vulnerable populations, as we must do as a city, and as I believe the vast, vast majority of Torontonians want us to do, and at the same time make sure that as we do that, we preserve safe and secure neighborhoods. And I will be back in touch with the family that are in charge of the Homeway business to see what more they think we could do, but I literally talked to one of their members on, I think, Sunday this weekend, and I will take their advice, though. I make these calls not just to check in on how people are doing, but also to get their advice on what more we could do, and I'll place a call to them later today.
Follow-up, Jenny?
Thank you. No, that's it.
Okay.
Thank you very much.
Okay, thank you. Thank you for joining us. This concludes today's briefing. Please remember there is a wealth of information about COVID-19 that can be found at toronto.ca/COVID-19. Please have a safe and happy Labor Day weekend. Thank you.